Thank you for joining us this morning. We're here today to discuss the MTA's dire need for additional and substantial federal funding to offset the financial impact of the COVID-19 pandemic. I'll start by expressing our gratitude to the New York congressional delegation led by Senator Schumer and Chair Anita Lowy for their hard work in securing nearly $4 billion for the MTA and the CARES Act. But the fact is we need substantially more help, and we need it now. $4 billion was an initial estimate of our operating budget loss, and it was conservative given the information we had at the time, March 17th. At that time, subway ridership was down 60%. It's now down about 95%. Same is true for the Long Island Railroad and Metro North. In the weeks since our first request, the crisis has dramatically worsened in New York, dwarfing our initial estimates of revenue loss. That's why we've conducted a detailed economic study led by Jano Lieber in close partnership with McKinsey & Company, which now projects the full impact of the pandemic to be between $7 and $8.5 billion, the effect on the MTA. The McKinsey study examined the range of impacts to the MTA's 2020 operating budget. After careful review, we are requesting that the next federal aid package passed by Congress include an additional $3.9 billion in emergency funding for the MTA to stop the immediate financial hemorrhaging in the MTA's 2020 operating budget. This is not something we can wait for. We need immediate action. Our subways, buses, and railroads are facing sustained precipitous drops in ridership by more than 90% across all transit agencies. And we've also experienced 62% fewer crossings at our bridges and tunnels. Based on current ridership and reasonable forecasts of a slow return to higher, but not pre-COVID levels in 2020, we expect to see losses in fares and toll revenues of between $4.7 and $5.9 billion this year alone, and additional impacts in 2021. Additionally, we're now able to forecast sizable losses of between $1.6 and $1.8 billion in state and local taxes dedicated to the MTA in 2020 as a result of the extraordinary economic downturn facing the region and the nation. We are also incurring significant additional expense related to the aggressive disinfection of our stations, rolling stock, buses, and workspaces that are only expected to increase as ridership returns. I want to be clear that traditional supplemental formula increases to existing transportation funding programs, which distribute dollars based on formulas that already shortchange the MTA, which accounts for 40% of transit ridership in the country, and which do not even consider the impact of the pandemic, simply don't work. We need Congress to provide a distinct and dedicated funding stream to the MTA, the epicenter of the disaster. And this is a disaster that has taken its toll on the whole of the MTA. Tragically, 68 of our brave colleagues have lost their lives during this pandemic. New York City Transit alone has more than 2,400 subway and bus employees who have tested positive for COVID-19. Another 4,400 of our colleagues are on home quarantine, and thousands more are calling out sick. While we are starting to see more employees return to work, we are not nearly out of the woods from an employee availability point of view. There are no words to express our gratitude to the hardworking men and women of the MTA who every day are doing heroic work moving other essential workers, doctors, nurses, first responders, child care workers, utility workers, those working in grocery stores and pharmacies, and of course transit workers themselves on the front lines of this pandemic, saving lives. Our workforce has proved how essential the MTA is in serving the region day in and day out. And the MTA will be just as crucial in propelling the city, state, and nation forward and out of this crisis, just as it continues to carry it through this difficult time. Restoring these economic losses is crucial for maintaining the economic vitality of the downstate region, which accounts for about 10% of national GDP. By investing in the MTA, the federal government will be investing in the future of New York and the entire region. Our system is the lifeblood of the regional economy and the national economy by extension. The nation needs a strong New York to lead the recovery from this pandemic. That's why we are asking our partners in Washington once again to assure that the next congressional legislation delivers at least $3.9 billion to the MTA to offset our COVID-19 related operating budget crisis, in addition to an appropriate level of stimulus funding. Thank you. I'll now turn it over to the MTA CFO, Bob Foran.
Thank you, Pat. The MTA's finances were in a precarious place before the pandemic began, and now that it's here, the traditional levers that we would use in worst-case scenarios are not useful. We're required to balance our budget. Normally, we'd have three options available to help do this: raising fares, cutting service, or deferring the bond-funded portion of our capital program. None of these are now tenable choices. With ridership so low, raising fares would accomplish nothing. Cutting service is another non-starter. We operate an essential service and have an obligation to keep the public in this region moving. Ensuring access to transportation is more vital now than ever. And regarding the third option, we've already put our capital program on pause until we have a path forward. And we'll be using previously committed to capital operating revenues for liquidity during this crisis. During this unprecedented time, the MTA can't look to its typical funding partners, the state and the city, because they're in a similar situation with their finances under extreme stress. That brings us to our partners at the federal level, who should appreciate the agency's value to the national economy. As Pat said, the MTA is the lifeblood of the New York economy, and New York is the engine of the national economy. We appreciate the federal aid directed our way through the CARES Act, but we urgently need additional help. The bond market has been very supportive of the MTA going back for decades. They provided much needed access to capital to restore a system that had been allowed to deteriorate. We believe the market will continue to be there for us, but we need the support of the federal government to give the investment community even greater confidence that MTA will make it through this pandemic and regain our financial standing. Thank you.
All right, and Janelle Lieber is also available to answer your questions, the first of which comes from Andrew Siff, WNBC.
Morning, can you guys hear me?
Yes, Andrew.
Okay, my question is, with the capital program pause, is congestion pricing now dead or just delayed? And is the signal modernization of the subways now essentially off the table, that once the economy reopens, commuters will sort of have to deal with the old signals for the foreseeable future?
Andrew, Central Business District tolling is not dead. The Central Business District team continues to work on it. Obviously, we need indications from US DOT in Washington as to what the environmental approach would be. We're frankly okay with either, but Central Business District tolling is very much alive. With respect to signal modernization is one of the key components from a New York City Transit point of view of the $51.5 billion capital plan. I think in every scenario, signal modernization will be a first order priority.
And Pat, Andrew, the signal projects that are underway are ongoing. We have, having been deemed essential construction work, we've kept those projects going. And equally important, the preparatory work for the signal modernizations that are in the yet to come in the next program has continued while the workforce has been telecommuting. The design work, which is obviously in-office work and on computer work, has been continuing.
Thanks, Jano. Next question is David Meyer of the Post. David. All right, David's getting his technical logistics straightened out, and while he does, we're going to go to Clayton Gusa. Clayton, the news.
Hey guys, can you hear me?
Yes.
I wanted to follow up a little bit on the statement that you guys put out regarding the MIT study yesterday. You guys called the study flawed, period. But the study, it's a preliminary look at the data, but it also had some conclusions in it, including staggering service, trying to reduce crowds on trains, stuff that you guys have been recommending since the start of this. So I'm just trying to understand what exactly is flawed with that study according to you guys, and are you guys seeking the advice of academic experts like Mr. Harris when you're trying to figure out how to reopen service in the long run?
So the study is flawed because it is preliminary. It's not published and it's not peer reviewed. The study itself recognizes that there's no causation established, and there is a correlation that the author suggests. The correlation, however, if you look at social density in New York before the pandemic, there were any number of hundreds of causes of social density: commercial activity, restaurants, bars, sports arenas, concerts, museums, the full gamut of life in New York. And the increase in the doubling of COVID-19 cases, which is a positive thing, began in March when the governor began to put limitations in place, and then on March 20th when the governor put New York pause in place. And the increase in the time of the doubling of the cases, a good thing, again, to note, there are any number of factors that can be correlated. With respect to staggering hours, that is something we're looking at. We have been on calls with transit agencies around the world, in Asia, Europe, and the United States. We continue to dialogue with them. And staggering hours and reducing crowding are things that those agencies are putting in place, and we're looking at all of those alternatives as we go forward.
Next question is Alfonso Castillo of Newsday. Alfonso, you're up.
Hi, everybody. Thanks for doing this. So Bob said that raising fares doesn't make any sense because so few people are on the system, but assuming at some point that rebounds, as you touched on, maybe not to pre-COVID levels, but if you get some amount of healthy ridership back, are you ruling out raising fares beyond the usual plan, or is the plan for now still to stick to the biennial fare increases of 4%?
Alfonso, there's been no change in the plans, fare increases that are baked into the numbers that Bob reports on. There's also no plan beyond that, raising fares beyond that level.
And the next question is David Meyer. Technical situation resolved. Go ahead, David, from the Post.
Yeah, I'm hoping maybe, Jano, you can explain this from your work with McKinsey, but why and how the MTA doesn't expect ridership to reach pre-COVID levels. Like, what I assume there's multiple factors at play there. What are they? And when do you expect ridership to? Where do you expect ridership to be at the end of the year, perhaps?
Well, and there are a lot of different variables that affect that. Obviously the principal one is the trajectory of the COVID pandemic in New York, and we're trying to look at a couple of different responsible ranges, and that's one variable that's very strong. The other is what is the trajectory in terms of the economic recovery and so on. Those are some of the key variables. The other is what is the public response to when the economy starts to revive at whatever pace. How do people feel about using public transit again? What are the behavioral and impacts on ridership as well? So all of those things together suggest to us that there's going to be, and also the experience of how long it took for ridership to come back in the Great Recession, David, which it took a couple of years to come back to prior levels. So all of those factors combining suggest to us that ridership in a sort of a moderate scenario may be in the 50 to 60% range of where it was before by the end of the year. Obviously, if there is a more severe COVID scenario, then you have much lower ridership. But that's how the variety of different factors are at play.
And the next question is Dan Rivoli from New York One. Dan, you're up.
Good morning. On the issue of the capital plan, I know previously MTA officials said there would be no new contracts given out. Is there a change in that when you say now that the capital plan is on hold? Are existing contracts having work stopped for any reason, health or finance? And yeah, are there any new details about the capital plan on that front?
Jano, do you want to speak to that?
Sure. Dan, what we've said so far is we've taken a 60-day pause in making any new commitments, contract commitments pursuant to the capital plan. And we notified the bidders for procurements that were underway, and as well as people who were expecting to participate in other projects or other contracts that were going to be competed. We haven't made a permanent decision. Obviously, the request that Pat has outlined today is a key element of determining when and to what degree we will be able to go forward with future going capital plan procurement. But you should know that the work of the existing projects has continued during the COVID crisis. Transit infrastructure was deemed an essential construction category. So with a lot of changes to how the logistics are taking place and how people are keeping social distance and making sure that crews are kept separate and tools are disinfected and many, many other things, the work of the existing projects has continued over the last month or 6 weeks.
Next question is from Jose Martinez of the city. Jose, you're up.
Good morning, everyone. Is there any sense at this point, and I know it's still fairly early, but is there any sense in terms of how much the MTA is going to have to commit to disinfecting rolling stock, cleaning stations, employee workspaces? How much of your budget will have to be devoted to that as we go on to with this thing?
Well, look, Jose, that number will be in the hundreds of millions of dollars of unanticipated expense in 2020. And those costs are almost certain to continue into the future, but it'll be hundreds of millions of dollars on the order of $400 to $500 million. Obviously, that is a first order priority for our customers and employees during the pandemic and also as it begins to subside and normalcy begins to return.
Next question is Dave Colon, Streets Blog. Dave Colon.
Thanks, Tim. Hey, Pat. So there was a transit center study that said that the MTA could wind up needing $8 billion. You're asking the feds for 3.9, which kind of seems like you're asking for the minimum, which that study had mentioned is a $4 billion shortfall. What's the strategy for asking for what sounds like a minimum, and what happens if we don't get the money?
Yeah, Jano, do you want to talk about the transit center?
Sure. Dave Colon, I think Transit Center was projecting over a 12-month period. That's first of all, obviously our analysis has to do with the roughly 9.5 months of the since the COVID crisis. So there's a difference there. They also used for their high end an assumption that there was basically the current condition of the 90+% reduction in ridership was continuing. So there's a slight difference in methodology. The CBC has also done a study which is a little bit yields an outcome in terms of the impact of the MTA's budget, which is a little below our analysis. I think if you look closely at the methodology differences, we're all ending up in roughly the same place. If you look at the midpoints between the ranges and eliminate and control for the differences, as I said, in some of the scenarios that are being used, we're all ending up in a very similar place, which is why I think that the advocacy community and transit center and others are likely to be comfortable and actually joining forces to appeal to Congress to take action along the lines of what Pat has outlined.
Next question is from Christina Goldbaum of the Times. Christina? Christina, can you? Yeah, you're on. You're on the air. Go ahead.
Thanks. Pat, you mentioned that you're looking at options to deal with overcrowding as things start to renormalize. But can you tell us any more details on what those alternatives might look like? If you're looking at time tickets, restrictions on how many people can enter stations, what does the renormalization period look like on the subway?
Christina, we are looking at all those things. As I mentioned, we're talking to transit agencies around the country and around the world. It is premature to make decisions. Obviously, we went from 100% service to the MTA Essential Service, which is 75% in general. And that service is, carrying 5 or 6% of our customers. I mentioned the good news that a significant number of New York City Transit and MTA employees have returned from quarantine, and that's a helpful thing. As the pandemic begins to subside, we'll also make decisions about, and these are serious and complicated decisions about increasing subway and bus service. Those aren't decisions we're going to be making today, and I can assure you we will do those in close coordination with Governor Cuomo and the state, and of course with the city. So all of those things are on the table. It's premature to make decisions, but we're looking at what the best practices are around the world by areas, transit agencies that have been affected by the pandemic.
Just a reminder to the reporters, you need to virtually raise your hand so we know that you want to ask a question. Since we have nobody who hasn't asked a question currently raising their hand, we're going to go back to somebody who has asked before and is looking for another, and that's Alfonso Castillo of Newsday. Alfonso.
Hold on. What am I doing here? Hi. So I think you sort of touched on this, but I am interested in sort of long-term ridership. It's down now. You're assuming some of it comes back, but is there an expectation that some of it, and maybe a good portion of it, never comes back? People discover telecommuting, certainly folks out in the suburbs, and us particularly interested in the Long Island Railroad. Is the expectation that it doesn't return to pre-COVID levels?
Look, Alfonso, those questions are unknowable at this point. We will have the advantages of significant urban centers in Europe and Asia and their experience, but even there, it is too early to tell. And what lasting effect the pandemic will have on commercial activities, real estate, retail, restaurants, et cetera, are important questions which are going to affect every transit agency in the world, and we'll be keeping a close watch on it. Tim, I note that Michelle Kasky from Bloomberg literally had her hand up.
Okay, love that. It's the old-fashioned way, Michelle. We're going to go to you then, and then after that, a follow-up from Dan Rivoli. Go ahead.
Michelle,
hang on. Yeah, no, that was on our end, Pat. Sorry about that. Go ahead, Michelle.
Hey, thank you for the call. So a couple things. I think if I heard you correctly, Pat, you were saying that the Congress needs to have a dedicated revenue source for the MTA. Are you talking about something beyond the new $3.9 billion that you're asking for? Are you saying even beyond the $3.9 billion, there needs to be a new funding mechanism?
No, Michelle, our ask today for the 2020 operating budget is $3.9 billion. The point I was making is the traditional in-place transportation funding formulas disadvantage the MTA, right? we generally get 15 or 16% of funding pursuant to those formulas, although we carry 40% of the transit riders in the nation. And the points are really twofold. The significant ridership on the MTA, frankly, the significant fare box revenue in the MTA, but also the fact that New York is the epicenter of the pandemic ought to be taken into account. And the traditional formulas, which frankly are biased, if you will, against the MTA, really don't work here.
All right, we're going to go to Dan Rivoli next. Dan?
Hi, this question is for Jano. I just wanted to ask about the L train project. I know April was the original end date for this. Do we have an end date and ready to announce? And how is the work proceeding amid this the pandemic?
We're on schedule, Dan. People have continued to take advantage of the GOs, although, as I said, that was a project that very aggressively altered its logistics to enforce safety, to make sure that, you know, people were kept separated if they were entering the pump room or any other small spaces to do work. But notwithstanding that, we have kept on schedule, and there'll be an announcement when we're done, but we're on track.
Next question is Andrew Siff.
Hi, guys.
Go, Andrew.
I had to duck out for a second, so I apologize if this has been asked, but with regard to the mandatory masks on transit, did you talk about, or can you talk about, what people should do if they have a fellow rider who isn't obeying that rule? Are you supposed to sort of narc out your fellow commuter? And what will MTA employees do if they see people without masks on buses and subways?
Look, what fellow customers should do, frankly, is move away, create social distance, go to a new car. New Yorkers, being New Yorkers, New Yorkers will politely suggest, a mask, a scarf, a bandana. But in terms of self-help, Andrew, move away, move to a different car. The other rules continue to be in effect, right? If you're not a first responder or an essential employee, stay home. If you're sick, stay home. And social distance is important in every context, including on transit. The last thing I'll add is the governor's executive order, which he issued yesterday. A mask, a bandana, a scarf, any kind of fabric will do to protect the health of people on the street, people on transit, and their colleagues and people around them.
All right, I'll observe that was literally the first time in MTA history a reporter has asked a question while actually mobile. He was moving down the road and asking a question at the same time. We're going to do three more. David Meyer, then Christina, and we're going to end with Michelle Caskey, just because we love that she's doing it the old-fashioned way. So first, we're going to go to David Meyer.
Yeah, so I assume, in the context of Andrew's question and in the context of the conversations we've been having about crowding over the last few weeks, that a less crowded subway and lower ridership is in some ways a public health priority moving forward. And I'm wondering if there have been any conversations about either, with city entities or state entities or inside the MTA about alternative forms of transportation that could take the weight off of mass transit as the recovery begins.
So David, all those alternatives and possibilities are being discussed with the state, city, other transit agencies around the country, around the world. We do have the benefit, I'll use the word advisedly, of the fact that areas in Asia and Europe went through the pandemic prior to the United States and New York, and will be in phases of recovery before we will be here in the United States and in New York. And we are very focused on learning what those transit agencies in particular have done coming out of the pandemic in early days, short-term plans, intermediate plans, and we're in active discussions with the agencies and the relevant trade associations.
All right, thanks, Pat. We had a technical issue with a reporter from AM New York who has emailed a question for Pat, which I'm going to take the prerogative of reading. He's asking if you could clarify if the $400 to $500 million expected to be spent on cleaning is on top of the $300 million mentioned earlier in the crisis for this, or is it a new figure that is a sum of everything so far and in the future? So if you've got that question, either you or Bob perhaps can clarify.
So I'd answer the question this way. That expense will be in the hundreds of millions of dollars of unanticipated and unplanned expense. What it will be exactly for 2020 remains to be seen, and frankly, what it will be in 2021 and going forward. But it will clearly be hundreds of millions of dollars on top of what we had budgeted coming into the beginning of the year.
All right, and now back to the regularly scheduled program. Christina, then Michelle, and then we're done. Christina from the Times, go ahead.
Hey, thanks, Tim. Pat, what happens if you don't get this federal assistance or it's not as much as you're asking for?
Well, look, we have to get the support. It is fundamentally it's critical to the MTA's short-term, intermediate-term, and long-term. We're really grateful to the congressional delegation led by Senator Schumer and Chair Anita Lowy for the first round of funding, and are going to do everything we can to assist them in making the case that the MTA, the state, the region, and the country will all benefit from these funds.
And Michelle, the anchor role here goes to you for Business Week. Go ahead.
Hi. So sorry to get bond geeky on you guys, but you have about $1 billion of some notes that are maturing on May 15. What's your plan to deal with that? Are you going to roll it over into long-term debt? Are you going to pay it with cash you have on hand? What's the plan for that?
So standing policy, bond geeky questions get addressed to Bob Horn.
Thank you. Yes, we're in process of putting together bond documents. I think the goal is to have a document out right after our board meeting next week. We do have funds on hand that can be used to take a portion of it out, but the thought is right now that we would use long-term bonds to take the bulk of it out.
All right, thanks everybody. We're going to be sending out by the usual advisory system some documents that are related to this, so look out for those. Appreciate your being here today, and thanks to Pat, Jano, and Bob. Have a good day, everybody.